Welcome back to 5 Sunday Morning. I'm Mitch Roberts. Dr. Kris Gast joins us this morning from Fort Smith Radiation Oncology. She's here to talk about hospice care for cancer patients. Good morning to you.
Good morning.
Why don't we start off with you telling us why hospice care is so important for cancer patients and how we can help them out with some information on that this morning.
Well, I think a lot of patients and families have a misrepresentation of what hospice care is, and there's actually two branches of hospice care now. There's general hospice, where the patient is cared for, they're terminally ill. It is the only Medicare benefit that is covered in the sense that the patients are eligible for both medicines, equipment, 24/7 days a week care, and post-care for the family after the patient passes. The main thing about hospice is that it just takes such good care of patients in the process of the end of their life, no matter what their diagnosis. But the criteria for Medicare is that they have less than 6 months to live based on what their physician has assessed. The other branch of hospice care is called palliative medicine, and it's completely different in the sense that there's no limitations in terms of diagnosis. This is just basically an extra layer of care for patients to have that have a very serious illness, and it helps keep them and their family better cared for. It's an extra asset for them on top of their regular patients.
Okay, well, we were wondering exactly if we could break down the difference between hospice and the palliative care you're describing. Sometimes when a family is facing the death of a family member, it is so tough for everyone to weed through all the information to decide what's the best step, and what's needed for each individual family might be different than the next family you talk to.
Well, palliative medicine is for patients who are undergoing treatment of any type. They have a multiple list of diagnoses ranging from heart failure to COPD, Alzheimer's patients, cancer patients as well. Those patients aren't necessarily expected to be terminal. They'll be going through active curative treatment, but it's just an additional branch of medicine that helps take care of them while they're doing that. Hospice medicine is specifically for the end-of-life care, when patients are at the end, they've gone through everything, and it's time to help them passionately and compassionately get through to death, basically.
Well, I know that the clinic also has some updates they'd like to share with people. When it comes to women with diabetes and certain medication, I know you want to share that with folks this morning. The medication is that metformin. I have that correctly pronounced?
That's correct. It's a very commonly used medicine for diabetes, and there was a study that came out just last week that was a very large study. It was part of the Women's Initiative group, and the data from that, which was almost 70,000 women in it, showed that women who were taking metformin actually had a 25% lower incidence of breast cancer. So, you know, metformin is a good medicine. It has lots of side effects, but it's always nice to find out when you have an actually good side effect.
Yeah, you always hear those commercials on TV with every side effect in the world that you wouldn't want. Finally, you bring us a good news story there. Well, we certainly appreciate that. For more information or questions, if you'd like to email Dr. Gast, you can do so at bfitzpatrick@fsro.net. Dr. Gast is a monthly guest on 5 Sunday Morning. We'll see her again in July. She is now the exclusive oncologist for Health Connection and soon to be on 5NewsOnline.com. So Dr. Gast, thank you very much for joining us, and we'll be back with more 5 Sunday Morning right after this.